This is the QTV Nightly News, coming to you from our studios on Kairaba Avenue, and I am Andy Kerma. Thanks for joining us. Here are the headlines. Today marks the centenary of Sir Dawda Kairaba Jawara's birth, the Gambia's first Prime Minister and later its first President, who was a pivotal figure in the Gambia's history. The medical and financial support for women and girls suffering from obstetric fistula in the ECOWAS member states program was launched today, Thursday, in Banjul. At a press briefing on Wednesday, the Epidemiology and Disease Control Program of the Ministry of Health and Partners announced that they will embark on a nationwide vaccination against Schistosomiasis. The project implementation unit of the Ministry of Tourism and Culture on Wednesday validated the long list report for the demand and destination assessment of tourism sites throughout the country. Those were the headlines, now the news in detail. If you're just tuning in, this is QTV Nightly News. Today marks the centenary of Sir Dawda Kairaba Jawara's birth, the Gambia's first Prime Minister and later President, who was a pivotal figure in the Gambia's history, independence, stability and growth. More from Lena Iigwenyiba.
Today, May 16, marks 100 years since the late Gambian President, Sir Dawda Kairaba Jawara, was born in 1924 in Barajali in Makati Island Division, now Central River Region. Sir Dawda's journey from student to leader exemplifies his dedication to the Gambia. Educated at the Methodist Boys' School in Banjul and Achimota College in Ghana, Sir Dawda's political career began with the founding of the People's Progressive Party, PPP, advocating for the Gambia's independence. His leadership during the Lancaster House negotiations in London in 1965 led to the Gambia's independence, and he became the first Prime Minister. His presidency from 1970 to 1994 was marked by stability and development, focusing on education and health care. Throughout his tenure, Sir Dawda remained committed to democratic principles and the rule of law. His dedication to serving the people of the Gambia earned him respect both at home and abroad. In 1966, he was knighted by Queen Elizabeth II, a recognition of his contributions to the nation. Today, as the Gambia honors Sir Dawda's 100th birthday, his legacy lives on in the hearts and minds of the Gambian people. His commitment to democracy, peace and development continues to inspire future generations to strive for a better tomorrow. As the father of the Gambian independence, Sir Dawda Kairaba Jawara's legacy is a beacon of hope and a reminder of the power of visionary leadership. May Allah grant him Jannah. Reporting for QTV News, I am Lena Iigwenyiba.
Tomorrow night from 10 p.m., QTV has a special 2-hour program honoring the life and legacy of Sir Dawda Kairaba Jawara. The medical and financial support for women and girls suffering from obstetric fistula in the ECOWAS member states program was launched today, Thursday, in Banjul at an event attended by international delegates, stakeholders and members of the media. Loli M. Kamara has more.
Obstetric fistula is a devastating childbirth injury that affects millions of women and girls in developing countries. It is a hole between the birth canal and the bladder or rectum, resulting in chronic incontinence, often leading to social isolation and stigmatization. The medical and financial support for women and girls suffering from obstetric fistula in ECOWAS member states program aims to raise awareness and provide much-needed support for women and girls suffering from obstetric fistula in West Africa. Dairos Sar, the UNFPA country representative in the Gambia, pointed out that stakeholders must work together to end the suffering of women and girls living with obstetric fistula.
UNFPA with its partners leads the campaign to end fistula globally, working in more than 55 countries on prevention, treatment and rehabilitation efforts, and reaffirm its commitment to eliminating obstetric fistula in the Gambia by 2030.
The new program, spearheaded by the ECOWAS Commission through the ECOWAS Gender Development Center in Dakar, aims to provide medical treatment, financial assistance, capacity building for healthcare professionals, and surgical interventions. Fatou Kinte is the Gambia's Minister of Gender, Children and Social Welfare.
The program is fully funded by the ECOWAS Commission through the ECOWAS Gender Development Center in Dakar at the tune of $245,000, equivalent to 16 million Gambian dollars, to be implemented in 6 months. The program seeks to provide a holistic support to women and girls affected by obstetric fistula, addressing their medical, social, and economic needs.
Babandin Sabali, the Deputy Permanent Secretary Technical at the Ministry of Health, says that for far too long, obstetric fistula has been a silent epidemic affecting the most vulnerable among us, adding that situation analysis on obstetric fistula in the Gambia in 2020 revealed a prevalence of between 0.46 and 1.45 per 1,000 women.
The Gambia also experienced high rate of early marriages. That stands about at 7%. National figure, 44% in the rural areas. It also experienced high adolescent birth rate, 14%, high fertility rate, 4.4%. All these are risk factors associated with fistula, coupled with low literacy and educational rate.
It is estimated that there are over 1 million women and girls living with this condition in ECOWAS member states, and this program aims to reach and provide support to all of them. Halimatu Tambadu, Jawara, Permanent Secretary, Office of the First Lady, and Tabara Toure, Director of Regional Integration from the Ministry of Trade, both recognize the invaluable support from the Ministry of Health, Gender, Children and Social Welfare, and all the health workers. Stakeholders at this event call on all member states to support and participate in this program, as it is a crucial step towards improving the lives of women and girls in the region. For QTV News, Loliam Kamara.
At a press briefing on Wednesday, the Epidemiology and Disease Control Program of the Ministry of Health, in collaboration with the World Health Organization, will embark on vaccination against schistosomiasis from the 17th to the 26th of May 2024. Julian Jai reports.
Schistosomiasis is an acute and chronic disease caused by parasitic worms. People become infected when larval forms of the parasite released by freshwater snails penetrate the skin during contact with infested water. Transmission occurs when people suffering from schistosomiasis contaminate freshwater sources with feces or urine containing parasite eggs, which hatch in water. Bala Jata, Neglected Tropical Disease Program Manager, spoke of the nationwide campaign.
This mass drug administration is targeting preschool age children, which is children that are in preschools, that is from age 2 to 4 years, 11 months, that's below 5 years. And then we also have the school age children, we call them SAC, that is those that are between the ages of 5 and 14. And then we'll also be treating at-risk adults. This, when we talk about at-risk adults, we're talking about people that come in contact with freshwater bodies that bore these vectors that cause schistosomiasis.
Dr. Pius Ononguwe, African Center for Disease Control and Prevention and the National Coordinator for the Gambia, and Dr. Ifeanyi Odongwezi, the representative of the WHO, expressed commitment to work with stakeholders to ensure that neglected tropical diseases are eliminated.
The drug being taken, and the people are saying that it has a negative effect. I want the media to join us to make this campaign very loud, that these drugs are safe, and this drug has the capacity of freeing our communities from the very negative burden of the neglected tropical disease, particularly schistosomiasis and the soil-transmitted helminthiasis.
This initiative is not only about immediate health benefits, it's part of a broader commitment to the global NTD roadmap, which mandates countries to conduct MDAs at least once a year to stay on track with the elimination targets. Through these efforts, we aim to significantly reduce the disease burden and improve the quality of life for our people.
Estimates show that at least 251.4 million people required preventive treatment for schistosomiasis in 2021, out of which more than 75.3 million people were reported to have been treated, according to the World Health Organization. Amadou Wuri Jallo is the coordinator of the Epidemiology and Disease Control Program at the Ministry of Health.
We therefore call upon parents, guardians, and community members to fully support this initiative by ensuring that all eligible individuals receive the treatment.
Schistosomiasis is prevalent in tropical and subtropical areas, especially in poor communities without access to safe drinking water and adequate sanitation. It is estimated that at least 90% of those requiring treatment for schistosomiasis live in Africa. For QTV News, I am Juldenyai.
We will now go for a commercial break. When we return, we have more local news stories. Do stay with us.
Looking for the perfect place to promote your product or place your advert? Look no further than QTV. We are the premier destination for businesses looking to connect with Gambian audiences and beyond. At QTV, we offer a variety of advertising solutions to suit your needs and budget. With our diverse range of programming, you can be sure that your ad will reach a broad and engaged audience. From our popular news broadcast to our exciting music and entertainment programming, QTV has something for everyone. QTV, the premier destination for advertising in the Gambia. Contact us today and let us help you reach your audience.
The art of juggling is a true spectacle of agility, coordination, and speed. A symbol of progression, precision, and mastery. "5G speed is like having the juggler in your pocket. With lightning-fast download and upload speeds, you'll easily be able to juggle even the busiest workdays. Whether you're a busy entrepreneur, a creative, or just someone who wants to stay connected. Juggle your tasks with ease with QCell 5G speed. The future is here. It's fast, reliable,
ku ñu doon laaj yagsi nañu laay day di daa Tobaski ak Style QTV 2024 bés ba agsi na jàpp nañu ko on the 17th of this month May fan lay amee ma ngay xewee foofa ca Q City ca Timba nga xam ne féex mag ngelaw la fu ne la lay jaar ñu ngi owaa réew mi ñëw leen ngeen book seeni booking ngeen xool seeni ay sañse yu ngeen mën a julle yéen ak seeni njaboot ndax ñëwkat yi nañu ñëwee ren ji dafa jéggi dayo jëratul ngay dem ci benn marché di jënd pèse yóbbu di ñëw di xat-xatlu da ngay ñëw toog ci biir Tobaski ak Style ca biir Q City nga gis ñetti morceau nga jënd grand boubou tayman daget dress lépp la suñu ay ñawkat préparel gaañi ci Tabaski ji yow mi toog di xaar ñëwal te bul ko kenn nettali di nga fa gis ay sañse dinañ leen amal ay ambiance di nga am entertainment kan moo leen di bégal waa Bright Stars akan xanaa Seex Fall borom daare lamp Fall borom téeméeri sabar juróom fukki tama moo nar a yëngal keroog guddi gi mu doon jàkkaarloo gu mësuta am fenn ci réew mi du xam ngeen QTV ni mu mënee bés ak ni mu fonkee bi le bés di Tobaski ak Style ndax Tobaski la ñuy waajal dafa am solo lool tickets yëpp a ngi available right now ordinary mu ngi jar $400 VIP $700 yaa ngi koy amee fii ci biir QCell Kairaba Avenue wala nga ekkati sa téléphone jokko ak ñoom ci nu mu gën a gaawee 324 44 44 ak QTV ni mu yàggee di jommal askan wi saa ñu teewee seen bés da ngeen di xam ne dañu ko téye amee ñëw nañ ci beneen facette.
Welcome back, and this is QTV News. The Project Implementation Unit of the Ministry of Tourism and Culture, overseeing the tourism diversification and resilience in the Gambia project on Wednesday, validated the long list report for the demand and destination assessment of tourism sites throughout the country. Lolly M. Kamara tells us more.
Tourism is an important element in the Gambia's economy, accounting for an estimated 20% of the country's GDP. Stakeholders in the tourism sector have long sought to improve the country's tourism offer. After months of in-depth study and evaluation by international consultants to produce a draft report, stakeholders in the tourism sector validated the long list and shortlist report on potential tourism sites. The long list report, which assessed the demand and potential of various destinations, is in alignment with the objective of diversifying the Gambia's tourism sector and the country's tourism policy and strategic plan in line with national development priorities. Momodu Sise, the project director of the Tourism Diversification and Resilience in the Gambia project, said, the validation of the proposed shortlist of sites is a crucial step in the process of assessing and selecting tourism sites for potential development into viable products.
The World Bank, in collaboration with the government of the Gambia, established a public-private dialogue mechanism to devise an action plan for COVID-19 tourism recovery. And part of that, the stakeholders gathered together to list some of the key tourism sites that they wanted to evaluate in order to actually determine what is the value and what sort of investment might be needed to make them products for Destination Gambia.
Organizers say the validation and review process considered a variety of factors, including the economic potential, cultural significance, and environmental impact of each site. Dr. Adamaba, representing the consulting firm Kios in the Gambia, elaborates.
It was tough because to have 64 sites and then decide on only 10 for an in-depth study, eventually for the Gambia government to look at investment in those areas was not an easy task. We were very excited about the whole thing and we did our very best to cover all the sites.
Aissatou Drame, Deputy Permanent Secretary at the Ministry of Tourism and Culture, and Kebanjai, the Executive Secretary of the Travel and Tourism Association of the Gambia, TTAG, respectively, both hailed the efforts of the Tourism Diversification and Resilience in the Gambia project. Dr. Simon Woodward, one of the consultants involved in the project, gave an online presentation on some of the report's findings. Some potential sites for tourism development include coastal areas with beautiful beaches and natural landscapes, historical sites of cultural significance, national parks, and nature reserves with unique flora and fauna, urban areas with thriving arts and entertainment scene, and adventure destinations with opportunities for hiking, water sports, and other activities. As regional competition to attract tourists intensifies, these stakeholders are confident that this thorough and transparent process will lead to the selection of top-quality tourism sites that will benefit both visitors and local communities, and that after today's engagement, the documents agreed upon will be successfully implemented to bring about the much-needed development in the tourism industry. For QTV News, Lolly M. Kamara.
The Gambia Press Union, in collaboration with International IDEA, supported by the European Union, is convening 2 days training for managers and editors on gender equality and inclusion of women journalists under the EU support to the consolidation of democratic dispensation in the Gambia project. Here is Aliu Cisse.
This training, which commenced on Thursday, is a follow-up to the just-ended training on ending sexual harassment in the media houses. The training is facilitated by Dr. Satang Nabani and Fatou Diagne, respected seasoned gender equality and human rights advocates. Mohamed Esba, the president of the Gambia Press Union, hopes this will be a stepping stone to having more women as editors and managers in the newsrooms and expects the training to be the bedrock to that advocacy.
I'm hoping that this will be a stepping stone to have a lot of editors, because now we've seen women are educated. They have the potential, obviously, to man these positions, even becoming editor-in-chief, media managers. So I believe it should be the step in the right direction.
With the increase in the number of dynamic women journalists, Jenaba Fai, head of country office, International IDEA, hopes women will be given their rightful places in the newsrooms. She says inclusion is key to achieve gender equality, which is not just the right thing to do, but the smart thing to do.
Gender equality is not merely a women's issue, it is a human rights issue. It is about ensuring that everyone, regardless of gender, has equal access to opportunity, resources, and decision-making processes. Bridging the gap that exists is imperative. We must acknowledge that gender discrimination still exists in various forms in the media, from unequal pay to limited access to education and development opportunities.
Rafael Brigandi, chargé affairs at the EU office in the Gambia, says enhancing media freedom and promoting gender equality remains key to the work of the EU. He advocates the adoption of inclusive policy in the media.
It would be good that next time more women are present, but on the other hand, to see the glass half full, it's also very encouraging to see that so many male journalists are also concerned and interested by the topic, and for that I do commend you.
Participants Usman A. Marong, manager of Nyomi FM, and Sally Jai of GRTS shared their views on the theme of the training and their expectations.
Women too, they should believe in themselves, believing in yourself and pushing yourself forward. I believe, with time they will come, but encouragement is important.
I think we should not be at the bottom position anymore. We should be at the top where decisions are made, and we should be included in any aspect of the work that we do in the various newsrooms and the programs department. So this is a timely training for managers here in the country to know that women can do it. We are capable, just like our male counterparts, because when it comes to education nowadays, every year, women journalists are graduating from the highest citadel of learning in this country. So there is no more an excuse to say that women should not be there and we should not be included.
Moderated by Abdullah Jawara of the Gambia Press Union, who also welcomed the training as timely. These participants are expected to serve as advocates for greater women's inclusion and gender equality in their respective media houses. Reporting for QTV News, I am Aliou Cissé.
Before we end, here's a recap of the headlines. Today marks the centenary of Sir Dawda Kairaba Jawara's birth, the Gambia's first Prime Minister and later its first President, who was a pivotal figure in the Gambia's history. The medical and financial support for women and girls suffering from obstetric fistula in the ECOWAS member states program was launched today, Thursday, in Banjul. At a press briefing on Wednesday, the Epidemiology and Disease Control Program of the Ministry of Health and partners announced they will be embarking on a nationwide vaccination against schistosomiasis. The project implementation unit of the Ministry of Tourism and Culture on Wednesday validated a long list report for the demand and destination assessment of tourism sites throughout the country. And a reminder that to commemorate the centenary of his birth, QTV will have a special program on Friday, 17th May, starting at 10 p.m. on the life and legacy of Sir Dawda Kairaba Jawara. Well, that's all we have for you in this bulletin. Join us at 10 p.m. for another bulletin. Thanks for watching.